I'm Sarah from the National Insurance Institute. It's the head office very close to here, and this is Jack, my colleague. We both work in the Research and Planning Administration of the NII, the head office, and Jack is in charge of the Information Management Bureau. Within the Information Management Bureau, we have the Publications Department, where I work. We produce, produce all the research publications of the NII, disseminate them. They're mostly statistics. The only other department of the NII which really produces publications is the Information Department, which produces brochures for the public. What I'm going to do in this presentation is tell you a little bit about the NII and about our statistics. Okay, this should really read, the NII is the National Institution for Social Security, because I know in many other countries in Europe and elsewhere, they have a few different organizations for Social Security. For instance, France has maybe 20 different organizations for Social Security. In Denmark, I think you have more than one. Some are in the United States, you have a few. Some are private, some are public, some are compulsory, some are volunteer. Some are associated with the labor unions. Sometimes you have unemployment separately and disability separately and work injury separately. In Israel, we have only one Social Security organization, very comprehensive, everything under one roof. We call it from cradle to grave because it has over 20 benefits, child allowances, disability, maternity, alimony, long-term care, everything is under the NII. It's compulsory. Every Israeli resident must be insured. Every Israeli resident is covered for all the benefits if they meet the specific conditions of entitlement to that benefit. And every Israeli resident must pay national insurance contributions. One way that we divide the benefits is between short-term benefits and long-term benefits. Short-term benefits are meant for people who leave the labor force for a temporary period of time, are expected to return to the labor force. For instance, women on maternity leave, reserve service, work injury. We give them a benefit based on their previous wages, and it's for a few months until they get back to the labor force. And then we have the long-term benefits, which are of uniform rate for people who leave the labor force and are not expected to return, such as old age pensions, survivors' pensions, general disability pensions. Another way we divide benefits are into contributory and non-contributory. The contributory benefits are based on the NII law, and the payments that people pay for their insurance contributions from their income is used to fund these benefits, which are most of our benefits. And other benefits are paid according to the government, the Treasury pays for them, and according to a special agreement and not under the NII law. But the NII administers all the benefits. Okay. The source of most of our data that we use in our research is our own internal files. We have extensive files. For every benefit, we have a file. For maternity, child, we have files. We have files for collection. We have employers' files, not employees, but employers. All the employers, self-employed, non-workers, who also have to pay insurance contributions. The minimum amount. This includes the unemployed, students. One question that a lot of people in the public in Israel even ask them, I don't work, why should I have to pay contributions? But I don't work. And the people who don't work, they have to pay a minimum amount of insurance contributions. They don't pay income tax, but they have to pay insurance contributions. There's nobody who is completely, there are people who are exempt if they get income support or things like that. There are certain exemptions, but everybody pays health insurance contributions. In a minute, I'll talk about the health. We also have access to external files. We use a lot of the files from the Central Bureau of Statistics, especially the manpower surveys and the family expenditure surveys we use for our research. We use files from the Income Tax Authority, particularly for the collection of contributions to know how much people really earn. Students pay a lower amount of insurance contributions, so we receive lists of the students who study at the various colleges and universities, and we know that they can pay a lower amount of contributions.
How many students
Students above? Okay, here's a list of some of our products, our main products, and the target audience were mostly researchers. They could be students, they could be academics, the government. I brought a few examples of some publications. All of them are available on the internet. Our site, by the way, is www.nioi.gov.il. Sorry, .bt, not NIO, BTL. www.btl.gov.il. Not NIO. NIO is our email system. Quarterly statistics, I'll give you an example specifically in one of the next slides. The poverty report, almost everybody has heard about because when it comes out once a year, it arouses a lot of public attention and interest. We have a press conference and all the Knesset members talk about it. And everybody says we have to do something about the high rates of poverty in the country. And after a few months, it dies down until the next poverty report, 24 hours. We also have, it's also on the internet. It's translated into English. The quarterly statistics is in English as well. Most of these publications are periodical, but not a certain amount. Whenever they come out, they're not specific time periods. Most of the publications have at least an abstract in English. For instance, this is from the series of surveys. It comes out usually in Hebrew, but there's the name and there's the abstract in English. We have a name in every publication. There's an abstract in English. It's also on the internet. This is a Social Security journal. It's not bilingual. It just has abstracts in English. It comes out every 3 times a year. It's supposed to come out 3 times a year, and it's more academic. It has essays and articles about issues on the agenda in social policy, social welfare, sometimes economics. Very interesting subjects. Every article is reviewed by reviewers until it comes in. It's our academic journal. It's also on the internet, available on the internet. Okay, we'll talk about some of the others. The quarterly statistics is this. It comes out every quarter year, of course. As you can see, it's almost all tables and a few graphs. It's divided into chapters according to benefit. For example, it starts with general and old age and survivors, and in every chapter it has the rate of benefit, the number of recipients, according to local branch. The NII has local branches throughout the country, 22 local branches. We work in the head office, but it has the recipients according to branch, according to where they live, the rates of the various benefits, the total payments by this particular branch, all the branches, plus statistics on the collection of contributions for every quarter year, January to March, April to June, etc., plus annual statistics. This is also available on the internet. There's an English version only on the internet, not a hard copy English version, but on the internet there's an English version of the quarterly statistics. It's the target, besides the target audience you see here, it's a tool for many employees of the NII, especially the higher the managers use this a lot. And the source of information here is our own files. The annual survey, this is last year's. As of this year, as of 2012, we changed the name because the Director General asked us to change the name to annual report. So you should know if it comes out, you see annual report, it's the same thing. Up to now it was called annual survey. It has 4 main chapters. The first one describes the socio-economic situation of the country over the past year. The trends of the trends and the benefits, basic trends, legislation. The second chapter is on poverty, the poverty situation. The third chapter is subdivided into the various benefits. Every benefit, we talk about how many recipients, the different trends, the legislation, etc., etc. And the fourth chapter is on collection of contributions. Many tables, many diagrams. I'm showing it to you. It has a review of the publications that were printed in the past year, a few appendices, and this is completely translated into English, but there's no hard copy version in English. There's an English version on the internet. Everything is translated. Plus, there's on the internet you can find abstracts in Arabic. If somebody's interested in Arabic, we have the abstracts in Arabic on the internet. Okay. This is something that is not a hard copy publication. It's something we have on our website. If you go into the NII website, which I gave you the address before, you go into publications and social policy, and from there you see, just 1 second. From there you see NII data, and this is all on the English side. We have a very good English website, by the way, and almost everything is translated into English currently online. So you go to the English side, you can find social policy and publication. From there you go into data. From there you go into statistics. When you get to the inside of this, it's in Hebrew. You put in a town, any town you want, and you see the statistics for that particular town. How many recipients of the benefit from that town? What's the insured population, what's the occupation, what's the average wage. And this is a lot of interest to the municipalities in particular. They want to know what the situation in their town is. Some municipalities in Israel have research centers, and they're very interested in this, or the social welfare bureau are very interested in this data. So they go into the internet, they put in their town, and they can find information on their town. This is dynamic, so we don't have a hard copy of publication, but it comes from our statistics. Again, the source of information is our own internal files. Okay, there's a lot of two-way cooperation between the NII and the Central Bureau of Statistics. We transfer them reports, and all our reports we give them the published reports plus some data that we have. And we use their surveys regularly, especially the manpower survey and the expenditure survey. Also, they have the average wage that the Central Bureau of Statistics calculates. We use it as a basis. It used to be a basis for all our benefits. Now we have something called the basic amount, but the average wage is still used for many other purposes. We have cooperation with other government bodies, such as the Ministry of Health. I didn't mention before, we don't produce medical data, and we do not. The NII does not provide medical services, as all the Israelis here know. In many countries, health is a part of Social Security. But our involvement in health is that because we have a very good collection mechanism and we're used to getting money from people very efficiently. When the health insurance law was passed and health insurance became obligatory, they decided to use the collection mechanism of the NII to collect health insurance contributions from the population and pass it on to the sick funds. So we just collect the money and pass it on to the sick funds. But we also have a health file, which we use for statistical purposes. And we have cooperation, of course, with the Ministry of Health and with the sick funds in this respect. Okay. In conclusion, we try to be very transparent in our research. Besides our own researchers, who work with the Research and Planning Administration, we encourage outside researchers to use our data, both by a research fund that we are willing to fund research for students and for researchers, if it's according to certain criteria, if it's in the areas that are of interest to the NII, we fund the research, and the research is sometimes published in cooperation with a researcher of our organization, sometimes independently. Plus, quite recently, we set up a research room in our office. We have a room with a special computer and a special code, and researchers who are meet certain criteria can come into the room and use our data. Of course, they can't see ID numbers or names, but they can use our data for their research, and we encourage this. Okay. Okay. Thank you.